Well, my husband and I remembered the date because it was his birthday. We both developed fevers, over 101, horrible chills, upset stomach, and I didn't think much of it. This is when, and nobody was wearing masks really yet, but I figured, allergy season's coming. And when he told me he was too tired to do a Zoom happy hour, I knew something was wrong. A full week after we initially got sick, on March 25th, I made my final virtual healthcare appointment. And the ER doctor said, "Can you hold your breath for me?" And I couldn't. It was just all downhill from there. Healthcare professionals not having protective equipment to keep them safe while they're saving our lives is unfathomable to me.
My name is Shikha Gupta. I'm a physician in Washington, D.C., and I'm here with my friend Allie to talk a little bit about her experience as a person who had and has recovered from coronavirus. And I'm very interested to kind of hear what your experience has been like, but would first love for you to introduce yourself.
Sure. Thanks, Shikha. My name's Allie. I live in New York City, originally from California. Been here for 15 years. I work in corporate marketing. I'm also an artist on the side, but I have an excellent life here in the city. I just got married in September. I just got a rescue dog in December. Living the life. My husband and I have a very active social life. We like to go out with friends. We host at our apartment a lot. We live in Murray Hill in Manhattan. So that's who I am.
Perfect. Before we jump into a bunch of questions that I have to ask you, I wanted to tell you a little bit more about Get Us PPE. So for Get Us PPE, I serve as the Director of Marketing and Communications and also am Vice President of our Executive Board, which gives me the opportunity to work with a group of amazing, incredible volunteers. So Get Us PPE was founded by emergency physicians in response to COVID and the PPE crisis. And our goal is really to mobilize everyday Americans. The silver lining for me, and I think for a lot of us who work at Get Us PPE, has been the ability to do something to make a difference. And I think part of that is really hearing the stories of the providers who are on the front line and then also patients who went through this experience and can tell us firsthand what it was like to have COVID and what it was like to be in a hospital. So we're so grateful that you have taken the time to join us on this call. And I know that you had this experience that has really kind of shaped this part of your life a bit, and would love to hear more kind of about it. So could you tell us just how this all started? How did you find out that you had coronavirus, and what was the experience like? What symptoms did you have?
Well, my husband and I remembered the date because it was his birthday, which is a nice extra special gift for him, but we both got sick on the same day. And when I say got sick, I mean we both developed fevers, over 101, horrible chills, upset stomach, all that fun stuff. And I didn't think much of it. This is when, coronavirus was really starting to grip New York City. It was becoming top of mind. Nobody was wearing masks really yet out in the streets. But I figured, well, it's, allergy season's coming. And I'm like, nah, it's just nothing, the tiniest bit of shortness of breath. But yeah, I set up like a Zoom happy hour for Joe's birthday, the night of his birthday. And when he told me he was too tired to do a Zoom happy hour, I knew something was wrong. So I canceled it. We went to bed, I think at 7:30 that night. And then it was just all downhill from there. We both had, again, high fever, and the chills and upset stomach and absolute loss of appetite. I think I ended up not really eating for 3.5 weeks during the entire thing. But we knew pretty soon after that it was very likely to be coronavirus.
So once you kind of had an idea that it was coronavirus, what did you do? Did you reach out to doctors or try to go to the hospital or get tested?
Yes. So I'm an NYU alum, and I'm also very privileged to live literally 2 blocks away from NYU Langone Hospital in Manhattan. And they have such an excellent reputation. I knew that they had an app. I downloaded it and I set up a virtual urgent care appointment. And as did Joe, we each had one. And the doctor said, well, to both of us basically, these sounds like you have coronavirus. Do not come in to get tested. There's no reason to get tested. Stay home, take care, fluids. We are chugging Gatorade, and just taking care of ourselves. That was the day after we both got sick. So we got sick on a Wednesday. Thursday, we spoke to the doctor. We continued. I was closely monitoring our fevers in a Google sheet because that's how type A I am. But I have a whole documentation of it. That Sunday, both of us were still sick. It had been 5 days, I suppose, and I started noticing more severe shortness of breath. Joe never got shortness of breath and was able to cover it home. I had my second NYU Langone remote appointment. They put me on azithromycin, which I was able to get delivered to the house. They didn't want me to leave to get a chest x-ray because, again, just the risk of me going out. And then over the next few days, Joe started to improve and my breathing continued to worsen. So his fever began to break. So a full week after we initially got sick, on March 25th, I made my final virtual healthcare appointment. And the ER doctor said, "Can you hold your breath for me?" And I couldn't. And he said, "Okay, I'm calling the ER. I'm telling them you're coming. It's time." So, and I knew. I had taken a shower that day and washed my hair, which was an insane thing to do, but it made me feel normal. And I just kind of knew it was, I'm laughing now because I knew it was coming. And then I wouldn't end up getting to wash my hair the entire time I was in the hospital. So I was grateful I did do that. But yeah, so I knew it was time and then I went straight to the ER after that.
What did the shortness of breath feel like for you? I think unless you've gone through it, it's really hard to know what that actually means.
Sure. Well, it's like I had different phases of shortness of breath. In the very beginning, it was very mild, like I couldn't take a super deep breath. But by the time I was going to the ER, and it literally felt like I couldn't inflate my lungs all the way. I will say, as I got to the hospital and as I worsened, it literally felt like somebody was rolling up my lungs like a tube of toothpaste. I also started feeling liquid in my lungs, which is very surreal. And it's not even like when you swallow water when you're swimming. It's really like, it feels like there's bubbling water in your lungs. When I was in the hospital at first in my own room, I had a private room with my own private restroom. And the toilet was literally 3 steps from the bed. So like living the life really close to the toilet. But it got to the point where they were pumping me full of fluids. I had to pee a lot. Taking the 3 steps to the toilet, I couldn't do it anymore because I literally couldn't breathe.
I'm just an admirer of your fortitude and so strong through it all. So when they kind of made the decision to, your whole care team decided that you needed to be in the intensive care unit in the ICU, what was going through your mind at that point?
There was a point where I looked at my doctor who was taking care of me. I think it was on the second day, and I looked at her and I said, "I'm scared." And she said, "Well, you should be scared. This is scary, and it's okay to be scared. I promise you we're doing everything we can to keep you healthy. You're in the right place, but we just don't know a lot about this virus. So if whatever can be done to help you, we are doing now." Which was a sobering moment. I appreciated the candidness because that's just how I like to be communicated with. But you know, and now of course in hindsight to understand that we just still don't know so much about this disease, it's scary. And to think I used to be scared about going like a routine surgery, like, a shoulder surgery, which of course is scary for the average person, but they've done them a million times, right? This is just such an unknown. But when they did actually tell me we are going to move you to the ICU, they asked me if I wanted to speak with a deacon or a rabbi. And I'm not personally a religious person. I think I'm a spiritual person, but them asking me that question, it suddenly like shook me like if somebody poured cold water over my head, like, oh my gosh, they think I could die. And these are the conversations people have when maybe they're going to die. That was pretty shocking. when I was in the ICU and I started worsening after I was able to FaceTime all my loved ones, they tried to swap me to a prone position as well. And that was what really pushed me over the edge. And I started coughing and I was never able to catch my breath again.
Can you just tell people what a prone position means? And what
Sure, just on my stomach. So it could open up the back of my lungs to try to just let some more air in there, so they could keep trying to fight the infection. But yeah, for some reason it didn't work for me. It does work for a lot of other patients, but they flipped me back over. I couldn't breathe. A lot of my care team would look through a glass door to check on me most of the time, and they were giving me the thumbs up, thumbs down, and I had been like, yeah, but I did the thumbs down, and I knew what it meant. I knew they were probably going to intubate me, but I was so exhausted, and even as a person that hates needles, and I was attached to everything, I was just ready. I said, I need to sleep. I need to rest. I can't breathe.
Yeah.
But yeah, that's when they came in, they told me they were going to intubate me, and that I think the decision saved my life because of the timing. He said, it's not an emergency to intubate you right now, but I think it could be an emergency in a few hours, which will be in the middle of the night. And I think it's just better that we do it now. And that made sense to me. I called my husband. He heard the doctor repeated it for him. I asked my husband to tell my mom and my sister. My mom and my husband were my healthcare proxies. And then I was like, let's do this. I mean, I did, I mean, it was very scary. I did say to the doctor, I don't want to die. He said, understood. And after the decision was made and I hung up with my husband, it felt very cinematic, but of course I was, no oxygen in my brain. I don't know what it actually looked like, but it felt like there was a rush of people came into the room. They laid me flat on my back. They raised me up, and there was a doctor above me. I think he was my anesthesiologist, but I'm not totally sure. But I looked at him and I said, I don't want to die. And he said, we wouldn't be doing this if we didn't think you'd come out the other side. And I said, okay, great. So now that we've got that covered, I don't want to wake up during this. And he said, that won't be a problem. You won't remember anything. We will have to wake you up to check your vital signs a couple of times, but you won't remember it. I said, okay, great. And then I was out.
And what was it like for you at this point, still being alone in the hospital, in the ICU, without, the ability for your family and friends to come and visit, and, really trying to have to make these decisions on your own?
It was hard initially, but I will say I'm so grateful that I brought my phone charger and my portable charger, because they were with me, spiritually, emotionally, that people were there holding my hand. But I had my phone with me, which is incredible, being able to FaceTime and just have them with me, but I really couldn't speak. And when it came to the end where I knew I was going to be intubated, I just love my loved ones so much. My husband would have been there with me, and he was there with me, but just not physically. I think it would have been so much harder for both of us if he had seen me like that. I feel grateful he didn't see me like that. Of course, I made it out the other side. So, but, it was hard, but I also, at that point, I didn't feel alone. Between everyone just communicating with me that loved me, and I knew they're all thinking of me, it's just the staff was taking such good care of me, and I just was at peace with being there alone. I was grateful that my loved ones didn't have to experience it there with me. When
you were at NYU, did you get a sense of what kind of PPE people had? Were people properly equipped to take care of you, or did you feel like there was some stress around
that? There was definitely some stress around it. And it did become evident when I was recovering, and I was able to talk to my nurses who were my age, and they said, they were wearing visibly dirty shields, visibly dirty masks. They were, being hyper vigilant about sanitizing everything, but, they were terrified to not only get the disease, but to bring it home to their loved ones at the end of the day. I think there's just, and again, this was 2 months ago almost, and things have changed a lot, but things had already become very strained seeming. So there was a lot of teamwork that was really visible for me, of them, helping each other, like yelling out the door, like, can you bring me, X, Y, and Z, they'll bring it, because they were already so mindful about conserving the PPE. So, my heart breaks, and I think it's so incredible what Get Us PPE is doing, because you guys are the physicians and healthcare workers and transporters and everybody, and nurses are the ones putting their lives at risk every single day to take care of like average Joes like me who never thought I would be this sick. Like, I have no pre-existing conditions. I never, and they saved my life. So, yeah, I mean, there was PPE, but there definitely was, definitely signs of strain on that supply.
But I want to know kind of what has it been like for you since you left the hospital? Because it's been a couple of months now, and in some ways that's a long time, but in a lot of ways that's no time at all.
I'm back at work. It feels surreal to just be on a Zoom call with my coworkers, like, talking about, I work in marketing, like, an email campaign. It's like, I almost died. It's like we're talking about open rates on an email campaign. It just feels very surreal. But I think I'm taking extra care of my body and my mind. I'm trying to take extra care of those I love and that I'm close to. And, I encourage people to reach out to me and talk to me. I think me getting sick, because none of us really knew anyone that got this sick, I was the one person a lot of people knew. And not just my immediate friends and family, it's like my coworkers, like their friends, their family, had an incredible ripple effect. And I think it kind of shook everybody to know somebody that's like normal and healthy and doesn't have any pre-existing conditions got this sick. I'm so grateful to the healthcare professionals that we're literally going into this not blind, but we don't know what this disease is. We still to this day don't know everything it's capable of. And to take care of me and all the other millions of people that are sick, I mean, I have the utmost respect from a family that has a lot of people that are physicians and nurses and other types of healthcare professionals. My gratitude is I have no words. And the fact that we have to worry about healthcare professionals not having protective equipment to keep them safe while they're doing, like, saving our lives is unfathomable to me. And anything that I can do or help, activate others to do to help this cause, I mean, I owe you guys my life. So it's my duty, honestly.
Yeah, that's so powerful. And I think people don't often understand how many healthcare providers touch a single patient during their stay in an ICU or in a hospital. And the numbers are really staggering. And I think you talking about how many teams of people were caring for you really speaks to that. So it's not a one-to-one number. And so for every one person that gets sick, there are tens of people, perhaps more, depending on how long people are in the hospital, that need the equipment that will protect them so that they can care for that single patient. And I think we owe it to other healthcare providers to make sure that they have exactly what they need to provide the kind of care that you received, because not every patient who's been in the ICU has had that level of care, and everybody deserves that level of care. Do you keep in touch with any of the healthcare providers that took care of you?
Yes, I mean, to your point, I easily had 40 people, so many people. I was there for 10 days. So many people that I encountered that I'm tracking them down through my medical records, all the last names and everything, but it's not just them. Like, I don't know the names of the transporters that moved me between hospitals. These two young women that were playing Drake and made me feel so normal for like the hour that I was with them. The janitors and like cleaning staff that had to come in. So many people. I won't ever be able to reach all of them, but I was very quickly after I was discharged able to connect with that PA who first admitted me and kept an eye out for me in the ER on social media because NYU Langone posted a photo series he had done. I said, I slid into his DMs and I said, this is probably a weird thing to say, but you helped me. I was there a couple of weeks ago and he remembered me. And then my twin sister ended up reaching out to him too. And he has a twin. Anyway, it was really cool to connect with him. And he said, we don't really get to see the other side of, especially in the ER, we don't get to see what happens to people. We don't know what happens to them. The fact that I was able to find him so quickly was very cool. But I'm in the process of writing many, many, many thank you cards. And I'm sending them to all the staff that I can find that helped me at NYU. But there's so many that I won't even reach. It's amazing. Yeah, I mean, so many people came in contact with me while I was there.
Yeah, that's incredible. And I love the story about the PA telling you that your vitals were not cute.
Yeah, I knew we spoke to each other pretty early there.
Same language. Yeah. Yeah, I think that's a really interesting perspective from his side too, in that this has been a really traumatic time all around for all Americans, I think, and for people around the world, but particularly for healthcare providers and patients who have really faced this disease head on and kind of looked at the ugliest sides of it that, many of the rest of us don't really get to see or really have the privilege of not seeing. And so to hear him celebrate the fact that one of his patients made it through to the other side is really, that moves me. I think it's, people do get really sick in the ICU. That's simply a fact. But to see somebody who's my age, one of my friends, go through this experience and then have a provider say, I'm grateful that I get to connect with you on the other side is so meaningful to me. And I think it's been traumatic for a lot of people, including patients. And I think we're starting to see the effects of this trauma on our healthcare providers and on essential workers kind of across the board. But I'm curious to hear kind of what has your experience been now that you're home and you've been able to reintegrate as much as you can into your pre-COVID life. What has that trauma done to change the way you think about things, or how are you dealing with it?
Well, I want to take a step back for a second. I just want to you made me think of something, just talking about the doctors and nurses and PAs and everyone. When I was discharged from the orthopedic hospital, when I got to the orthopedic hospital, I was one of a handful of COVID patients that had been moved there. There were still a lot of orthopedic patients that they were trying to triage out to other rehabs. They were recovering from hip surgery and knee surgery. And by the time I left, 6 days later, the hospital was exclusively COVID recovery. So I was one of the first COVID patients that was recovering in that location. So when my nurse and the doctor I had the day I was discharged spoke with me, they were both saying, you're the first person I'm discharging. I'm just so thrilled to see somebody feeling well and smiling and laughing and talking without oxygen. And even when discharging me, they're like, we don't even really know what to tell you yet. We monitor your symptoms. Don't take Advil. Don't take, anything that could impact your blood clotting. But they just didn't know what to say. So it was cool to be that person. I didn't get one of the big cheers. Now they, people leave, they have the big cheer, but it felt like that anyway. I was just thanking everyone I saw in the hallway. They're like, who's this woman?
Just imagine you being wheeled out and high-fiving this.
Yeah, what's up? But I couldn't touch anyone, but that's how it felt anyway. Yeah, dealing with the trauma, it's just, I'm still absorbing it. It just gives me perspective, and that obviously COVID is not a great equalizer as it's impacting, certain communities way more than others, but it is, anyone can get it. Anyone can get it, and it doesn't discriminate as to who it's going to take down as hard as it took me down and others who didn't survive. It just puts things in perspective, and it just puts the daily thing, being bored at home, I know it is a mental health struggle for a lot of people. I mean, myself included. It's hard to be isolated from friends, and we're such social beings. But I feel grateful for that to be my problem right now. I feel so grateful, and just am looking for ways to give back, even in little, give back to even people that are around me every day, around me. We're talking every day. Like, hey, do you want to like just checking in on my loved one? Everything's a privilege now. Like eating a great meal that my husband cooks is a privilege now. I took it for granted before, to his credit. But yeah, it's as simple as just not taking anything for granted, basically.
Yeah, I love that. I think that that kind of gratitude can only come from going through an experience like this and being really close to losing things, and then realizing how important they really have been to you. And I'm certainly guilty of kind of losing sight of the bigger picture and worrying about the little things. And I'm so inspired by the way that you are handling this and thinking about this. Yeah, as we kind of move into this next phase and people are kind of getting back out into the world, how does that make you feel, knowing that you went through this experience, and as you said, it could happen to anyone?
Yeah, it'll be a tough thing to navigate, but I will say, wear a mask. It's a stupid thing to say, but you know, I say to my friends, just wear a mask. If that's the hardest thing, you know, the one thing you do, and not even thinking about the people that you love, your friends, your family, beyond that, think about the healthcare workers that have been going to work every day, every week. This has been such a part of their present reality. They're the ones who are going to take care of you or your loved ones or whoever may be that gets sick. Regardless, they're there for you. Wear the mask for them, because the way that this spreads in an exponential fashion, if you happen to be that differentiator of like breaking the cycle, do it. It is the smallest gesture and it has such a huge impact. And think about the nurses that were taking care of me that hadn't seen their kids in 2 weeks because they didn't want to expose them to COVID, because they were taking care of me. You know, I know it's their job, but this is more than a job. This is like a calling. They are caring for others at the, you know, it's like our service people. They're putting their own life on the line to protect us. So I just think it's important to keep that in mind.
I love that. Thank you so much, Allie. I mean, on a personal note, as one of my good friends, I am just so grateful to see your face and to get the chance to talk to you about your experience. And I am so just incredibly happy that you are healthy and have, you know, the ability to come out on the other side of this and share your voice and your perspective and your wisdom with all the rest of us. We need more people like you who are willing to tell their stories and get involved and make a difference and share with people how it's scary, but there are things that we can do to make it better. And there are things that we can do to stop the spread.
Yes, thank you for everything you're doing at Shikha, everything that Get Us PPE is doing, everything that all the healthcare workers and frontline workers are doing right now. You know, we owe our lives to you. So thank you.